Hi guys, this is Dr. Bijor with Oakview Medical Associates. I'm a board certified family physician. Today I wanted to speak about Chagas disease. Chagas disease is an infection caused by the kissing bug. Kissing bug is an insect that is typically endemic to Latin America, but it has been found now in 32 states here in the United States. So it's important for us to know what this is. The kissing bug disease, also known as Chagas disease, was discovered in 1909 by a Brazilian scientist, Dr. Chagas, and that's how it gets its name. Mainly there's a parasite called Trypanosoma cruzi, which is transmitted by the vector, the kissing bug. And once the kissing bug bites typically the face of a human being or an insect, then once it's fed the blood, it can pass the feces onto the tissue, and the feces carry the Trypanosoma cruzi parasite. And once that gains entry, the human gets infected or the animal gets infected. What are the symptoms? So the symptoms range from acute symptoms, which are fever, body ache, just feeling tired, fatigue, and then you can also have a non-specific rash. Lymph glands can be swollen, and like I mentioned, the bite site can get really swollen, and that's called a chagoma. The eyelid tissue, if the bite is by the insect is around the eyelid tissue, that's called Romaine sign, and that's pretty typical of Chagas disease. Chronic symptoms, if this gets left untreated, then chronic symptoms mainly infect the heart tissue and the digestive system. In the heart, it is known to cause arrhythmias, irregular heartbeats. It's also known to cause cardiomyopathy, which is the term we use when there's weakness in the heart muscle or enlargement of the heart muscle. It can also cause weakness in the digestive tract. So a large, enlarged esophagus is known as a mega esophagus, or a large colon called megacolon. So these are the symptoms that are more in the chronic phase of the disease. It can last for years. So it's important to think about this in any individual that has symptoms and has a history of recent travel, because the acute symptoms are seen in the first few weeks to months. Chronic symptoms are there for months to years out from the infection. So it's really something to be considered, and there is a treatment, there is a test available. So if you have symptoms and you've just come back from Latin America, Mexico, for that matter, now it's also been seen, the insect is found in California, Texas, Arkansas, Arizona, so a lot of our southern states. It's really important for you to seek the help of your physician, or just ask to get tested for this. There are treatments available like benznidazole and nifurtimox, so it's important for us to think about this. Thank you.